Intraosseous vascular access. The EZ-IO provides intraosseous access when intravenous access is difficult or impossible to obtain in emergent, urgent, or medically necessary cases for up to 24 hours. It provides rapid, smooth entry into the bone's medullary cavity, creating an immediate conduit to the central circulation. Contraindications for using an EZ-IO includes a fracture in the target bone, previous orthopedic surgery, attempted IO access, or the patient has had IO access in the previous 48 hours in the target limb, infection, trauma, or burns at around insertion site. Equipment needed included an EZ-IO drill, needles, which include pink 15mm size for pediatrics, blue 25mm size for most adults, and yellow 45mm size for proximal humerus or patients with bigger frames. There is also a securement dressing, a 3-way tap, and extension set. There are multiple insertion sites, starting with proximal tibia for infants and children under 6 years old, which is the preferred site. We then have the distal tibia, where the medial malleus meets the shaft of the tibia. We then have the distal femur, where you go 2 finger widths above the condyle of the knee. And then there's the humeral head in the tubercle velocity. The proximal humerus O insertion site is located 1 to 2 centimeters above the surgical neck of the humerus. To identify the insertion site, place the patient's hand over the abdomen. Place your palm on the patient's shoulder anteriorly. The area that feels like a ball under your palm is the general target area. Clean the area following local policies and guidelines. Pick the correct size needle, which would be yellow. The needle tip is inserted at a 45-degree angle to the anterior plane and posteromedial. If the 5mm marker is not visible, do not proceed. Stabilize the hub and detach the driver. The stylet twists out of the hub. Place in sharp spin. Place the dressing over the hub and attach it to the skin. Prime the extension tubing before attaching it to the securement dressing. Attach the extension tubing and open the clamp. Stick down securement dressing. Aspirate the syringe to check for bone marrow. Flush catheter 5 milliliters.